Hello, thanks for joining me at the PBM and Tinnitus-Sleep channel. I'm Dr. Katoyun Montazeri. A few weeks ago, I decided to produce a series of videos about the triggers and improvers of tinnitus. I made the first video about noise exposure and stress, the effects of stress as the triggers of tinnitus, but I couldn't publish it. As you may know, in my country, Iran, we fell in a chaos and thousands of my fellow countrymen were brutally killed and slaughtered. We are mourning now and we can't do anything else. Nevertheless, I decided to continue producing the videos because I know that these videos can be very helpful for tinnitus sufferers, but I don't know when I can publish the videos because of the cut off our internet. In this session, I'm going to talk about the sleep-related triggers of tinnitus. Insomnia or lack of sleep and tinnitus often worsen each other and producing a kind of feedback loop. Tinnitus interferes with falling or staying asleep, and poor sleep increases tinnitus distress and intensity, and increased distress makes sleep even harder. We can see that there is a feedback loop, and breaking this loop can significantly improve tinnitus. Sleep-related triggers are including sleep deprivation, irregular sleep schedule, poor sleep quality, and sleep apnea. Poor sleep quality means that the person not getting restorative and refreshing sleep, and it doesn't related to the time that you spend in your bed. It's about how well you sleep and not just how long you sleep. And sleep apnea means that the breathing repeatedly stops and starts during sleep, and the pauses can last a few seconds to over a minute. And it may happen many times per hour without the person realizing. The common symptoms of apnea are loud chronic snoring, gasping or choking during sleep, excessive daytime sleepiness, morning headaches, trouble concentrating, memory problems, and irritability or mood changes. It's important to know about the symptoms of apnea because untreated sleep apnea can increase the risk of high blood pressure, heart disease and stroke, type 2 diabetes, depression, and work or driving accidents due to fatigue. So if you have the symptoms of apnea, you should consult with your doctor, and you should find a treatment because it can be dangerous and it has many side effects. And treating apnea help in treatment of or improvement of your tinnitus. But what are the effects of sleep-related problems on tinnitus? Um, Lack of sleep may affect tinnitus loudness because it increases the activity of the auditory cortex, and also it reduces the brain's filtering ability. As I told you, our brain has the ability to filter the repetitive and non-informative sounds, and in insomnia, this ability may reduce, that make the tinnitus louder or more intrusive. And it can cause emotional distress because it increases irritability, anxiety, and depression, all of which amplify the brain's emotional response and lead to amplifying the tinnitus sound. And it can affect habituation. Habituation refers to the brain ability to learn to ignore tinnitus, because your brain learn to ignore tinnitus. It called as habituation, but chronic insomnia impairs neural plasticity, means impairs the compensatory brain's compensatory changes, and leads to slowing or preventing habituation. The other effects of insomnia is related to stress response. It elevates cortisol and sympathetic activity, and cortisol is the stress hormone, and this leads to increasing in intensity of tinnitus and triggering flare-ups, and also it makes the patient more reactive to sound. Another effect of insomnia is related to sound tolerance. Insomnia can worsen hyperacusis. Hyperacusis is means that hypersensitivity to sound. Patients with hyperacusis are very sensitive to the sounds more than the ordinary people, and it often coexists with tinnitus. And this makes everyday sounds more uncomfortable and draws attention back to the tinnitus. And the other effect of insomnia is related to cognitive function. Poor sleep reduces concentration, memory, and executive control, which makes the patient harder to distract from tinnitus, and increases awareness throughout the day. So it can amplify tinnitus. In general, people with tinnitus and insomnia are more likely to develop chronic distressing tinnitus. I regularly read the stories of tinnitus patients on Reddit and Facebook. Many of these patients complain about the increasing or amplifying tinnitus sound at night. And they always ask why tinnitus is worse at night. These are the reasons. Because there is a reduced environmental sound at night, and also there are increased attention and hyper focus at night, and there are anxiety and anticipatory stress at night, because in many people, many tinnitus patients, in these patients, there is a development of a learned association. Night equals tinnitus equals no sleep. So this idea can trigger tinnitus and trigger anxiety, and this anxiety amplify tinnitus perception. And also there is less suppressing of irrelevant sensory input at night, because during the day our brain always try to suppress the irrelevant sensory inputs, but this suppression become reduced at night. And there are higher sympathetic activity and cortisol amount at night, especially in tinnitus patients with insomnia. And another reason is about the effects of lying down. When lying down, blood flow and blood pressure is changed, and some people experience increased awareness of pulsatile or tonal tinnitus. And at night, the fatigue lowers coping capacity. And another effect is about the vision. Vision helps orient the brain externally, and in darkness, sensory input decreases, pushing awareness inward. And when your attention push to inward, you can feel the tinnitus sound more, or the tinnitus sound will be amplified. But what can we do? What actually helps? One of the treatments is using low-level sounds, because it can remove the silence, and it can reduce the contrast between the tinnitus sound and the environmental sound. And another thing is breaking the anxiety sleep association, and consistent sleep timing. Even with poor sleep, tinnitus patients always have to always should try to sleep in a certain time. It's very important, especially for the patients with insomnia. And another solution is treating insomnia using some methods like cognitive behavioral treatment. There are some medications for insomnia, and some of these medications, like melatonin, is OTC or over-the-counter medication in some countries, like Canada or the US. But I highly recommend you to use the non-invasive methods like white noise, and then if you haven't responded to these methods, you can use medication under the prescription of your doctor. It's very I highly recommend you to use these medications under the prescription of a doctor. But one of the methods that used for decreasing and improving insomnia in tinnitus is using white noise. White noise is the noise that contains all frequencies of the sound that people can hear in equal parts. It's like the static from radio from a radio that isn't tuned to a specific station. You can get it from the YouTube. Tinnitus, as I told you, becomes distressing because of contrast, a constant internal sound against silence. And white noise raises the background sound level, so tinnitus no longer stands out. This is the basic basis of using white noise in treatment of insomnia, insomnia and tinnitus. But how white noise affects tinnitus? As I told you, it reduces contrast. Tinnitus distress is because of contrast between internal sound against silence, and white noise raises the background sound level, and the goal is to make it less dominant, make tinnitus sound less dominant, and it decreases brain hypervigilance. In silence, the brain activity scans for sound, and white noise gives the auditory system a stable external signal, reducing monitoring of the tinnitus. So it can be very useful, and it promotes habituation. As I told you, habituation is a defense mechanism against tinnitus, and a consistent neutral sound helps the brain learn tinnitus is not important. So it can improve the habituation over time. This supports habituation. But the effects of white noise are it can interrupt the anxiety tinnitus loop because it reduces the emotional reaction to tinnitus at night. So it lowers anxiety and reduces cortisol level and makes sleep onset easier. And it stabilizes sleep transition. It prevents sudden silence during micro awakening, reduces sleep fragmentation, and make nighttime awakening less distressing. But how to use white noise correctly? It's very important to use it correctly. The volume should be below the tinnitus level. It should be continuous, steady sound and placed near the ears, not in the ears. Using AirPods uh, aren't useful. It can be harmful for your ears, and you should avoid high volume, and as I told you, you should avoid earbuds overnight because of the safety concern and also the risk of dependency. One of the questions of the tinnitus sufferers is about earplugs. Earplugs can be very useful, and also they can be harmful. But when these earplugs can worsen tinnitus, because why they may worsen tinnitus? Because they can increase the contrast, and as I told you, the contrast is harmful for tinnitus. So the contrast between tinnitus sound and the environment should be reduced to improve the tinnitus. And they can raise the auditory gain or auditory sensitivity, because the auditory system focus on the tinnitus sound, because they delete the environmental sound, and they helps in focusing attention inwards. So they can worsen tinnitus, but they are very useful for loud and noisy environments, concerts, power tools, using when you want to use power tools, and for short-term noise protection. They can be very useful in these situations. Thanks for your attention. For the next time, I will talk about the effects of diet or dietary triggers of tinnitus. If the video was useful for you, please suggest it to your friends and subscribe the channel and suggest it to the tinnitus sufferers. I wish safety and peace for all of the people of the world and also the people of my country. Have a nice time.